So I often get asked for upper eyelid treatment, frequently asked questions or FAQs, and I love these because they're very common and can occur in many variety of patients. But number one is, does it hurt? And the answer is no, it doesn't hurt. Upper eyelid treatment is usually outpatient. In our centers, we use electrocautery, and it's very rapid recovery. It's about 10 minutes per upper eyelids. The typical instruction is to use ice every hour or 2 hours in the immediate post-op period. Patients always ask me the question number two, when can I go back to work? Can I drive? And the answer is you can go back to work. Depends on the type of work you do, but typically what we say is we want to take it easy the first couple of days because you will have a little bit of inflammation around the eyelids. But really the best thing to do is ice every 1 hour to 2 hours the first 2 or 3 days. You can drive the next day because your eyes are not covered. There'll be a very small steri strip that comes off within a day or two after the actual treatment. The third question is, do you use stitches? Do you use dissolvable? Do they have to be removed? And what does that look like? Do I get a lot of bruising? Immediate post-op period, within the first 2 weeks, what we tell patients is you can get some swelling around the upper eyelid, lower eyelid, even though you can just do the upper eyelid region. You can get a little bit of tracking down here, some bruising, and that's common. If you ice it, you'll minimize that effect, and you can immediately go back to driving the next day. If you're doing a lot of heavy manual work, then we say take it easy first 2 or 3 days. We do use stitches, depends on the surgery, but typically the stitches are removed usually about a week or two after the treatment. They're very small, we can barely see them. And usually for the upper eyelid region, we usually use 1 or 2 only. So it's minimal, you can barely see them. Occasionally if the patient qualifies, we can have what we call self-absorbing stitches. These are sutures that basically absorb within a week or two, and they work really well, especially in children and people who have difficulty coming back to the office right away. But having done thousands and thousands of eyelids, it's one of the most rewarding and fulfilling treatments that I like to give as a surgeon to my patients because the patients see an immediate results. And what's interesting, I've never had anybody yell at me for looking 10 to 15 years younger. We're very excited about this technology, and if you have any questions, please ask. Thank you.